And welcome back. Some of the symptoms of the flu and COVID-19 are similar, which could make it hard for many of us to know what's wrong. So today, the ways these illnesses are different and why you should consider a flu shot this year.
Dr. Nicole Brady is the Chief Medical Officer at UnitedHealthcare of Wisconsin. We're so excited to have her here. Good morning to you, Doctor.
Oh, good morning. Thank you for having me.
Thanks for being here. I think this is a really tricky year for people and scary too, because oftentimes symptoms are very similar. So I'm really happy that you're going to break it down. I think it's a really important conversation. So let's start with the flu shot, because many people, Molly and I talked about this. I've heard other people talking about it. Should you be getting a flu shot this year?
Absolutely. Absolutely. It is the number one way to prevent that infection for yourself, for your family, and for you to prevent spreading it to other people in your community. So very, very important this year, even more so than other years, to get your flu shot.
So some people, I think it'd be easy to confuse some of the symptoms, because some of the symptoms of the flu mimic COVID-19 symptoms. So how are they different?
Honestly, in an individual person, they're basically indistinguishable. Both are respiratory infections. So both can cause fever, cough, stuffy nose, sore throat. The really only distinctive symptom for COVID is really the loss of taste and smell. But that's tricky, because if you've ever had a stuffy nose, sometimes you just can't taste and smell as good as usual. So very hard to tell the two apart.
So what are some of the other symptoms that are shared between the two?
Again, all of those typical respiratory symptoms. So sore throat, cough, achiness, being really tired, just generally not feeling well.
I think that's something that strikes me is how exhausted people are when they have COVID-19. So it's the body aches and just that overall exhaustion.
Yeah, and again, symptoms can vary between people. I'm sure you've heard of people who've had almost no symptoms. We have people who test positive that have no symptoms at all. Some people will get a very mild cold. And then unfortunately, some people get seriously ill, end up needing to be hospitalized or even on a ventilator. And then there's that very small group that can even pass away.
I know. I think it's a scary year. For the flu, what is UnitedHealthcare doing to help raise awareness about the flu this year? I've heard it said, why wouldn't you take something off the table, so that if, you can just help your body be a little bit healthier this year?
Yeah, really, we're promoting the flu shot as much as we can to all of our populations. And remember, it's not just about preventing that infection in you. It's about being good family members and community members and not spreading it around to other people, but then also doing what we can to support our local providers. We know that the more people that get the flu shot, the less people that will become ill or need to be hospitalized from that infection. And they're already struggling with treating people with COVID, that we just don't want to add more burden to our frontline healthcare workers that are working so hard to support us in our communities right now.
What are you hearing about getting the flu shot this year? Because I found it fascinating in your wellness checkup survey that 30% of Americans say the pandemic has made them more likely to receive the annual flu shot this fall.
Yeah, isn't that great? I mean, the good thing that's come out of this pandemic is more people are willing to get the flu vaccine. And that's super. And I think it comes from a variety of reasons. One is people just don't want to get ill. Maybe they even had COVID and they don't want another infection like that again. And two is they want to avoid using healthcare as much as possible and having to go in and be seen. And three, there's just that unknown. We don't know what happens if you get both COVID and the flu. Is your infection going to be even that much worse? Perhaps you're more prone to getting the flu if you've already had COVID. We just don't know any of that right now. And I think that's just encouraged some people to not take the chance and get the flu vaccine.
And lastly, too, can you diagnose these through a telehealth visit with a doctor, or do you really need to be in person?
Yeah, actually, I think a telehealth visit for somebody who has mild to moderate symptoms, so not somebody that needs to be go to the hospital or are severely ill, I think telehealth is great because, as I said before, the two are almost indistinguishable in an individual person. And telehealth is a great way to have somebody try to navigate through with you which one they think it is and whether or not you truly need to go in. Both infections do have a test, and no, you can't get a test over your computer screen or through your phone, but at least those providers can tell you if you really need to go in and if you really need to get any kind of testing or diagnostics at all. So it's a great way to start.
So you're UnitedHealthcare. I'm wondering what your thought is about people going to convenience care centers or pharmacies or other locations like that in some cases are advertising free flu shots.
Mhm. I think it's great. Actually, my kids are going to go to the pharmacy this year and get their shot because they don't have any other appointments and I don't want to burden our provider's office. So we're going to go to the local pharmacy. The pharmacists have been well trained. Convenient care clinics, those staff there have also been well trained. So I don't hesitate. Many employers even bring in nursing staff for a day or two to do shots there. Again, the flu shot is a quick and simple, easy thing to get. It really does not take a lot of training to even give a flu shot, so perfectly safe to go to alternate places other than your provider's office for that vaccine.
I was hoping you were going to say that because I took all three of my kids to the local pharmacy to get their shot. And I was like, please say it's okay. So,
Can't take it back now.
Doctor, thank you so much for your time. I appreciate it. It's so important.
Thanks, Dr. Brady.
For having us. Thanks
Absolutely.
for having me. Have a great day.
You too. And again, UnitedHealthcare is really encouraging people to get their flu shots this year because the flu and COVID-19 together have the potential to overwhelm your immune system as well as medical providers, as the doctor just mentioned. Be sure to talk to your doctor before you do that. But to find out more about the best place to get your flu shot and more information, you can visit uhc.com.